All right, let's jump in. So first off, I'm going to tell you what we're going to be covering today. So we're going to go over what the exam looks like, some study tips, what your study schedule should look like, and then ultimately what the OCE is going to look like and how to prep for it. So one of the big things I want to make sure that you understand is trying to kind of demystify this process and ultimately making sure that you're not afraid of this process. This does not need to be a scary process. Seriously, it doesn't. You prep right, you prep smart, you prep in an organized and efficient way, and you'll get through this no problem. Okay, so the written PCE is composed of 180 Vignette style questions. Now, they're going to give you information that is about the client. It could be in, or it's going to be in paragraph form. Not all the information in that paragraph or that vignette is going to be relevant to each question. Typically, there's around kind of 3 to 6 questions for each vignette. Okay, your options are going to be A through D. It is the best answer exam. And I'm going to pause to like soak in that you understand what best answer means, because this is what makes this exam a doozy, is that all 4 answers could be right, but one is going to be the most correct. Okay, and that's what makes it difficult. It's a huge component to our course, is that we're teaching you how to figure out what's the most correct answer. All right. So the exam has 180 Vignette style questions and then 20 standalone questions. Now, standalone questions are typically the things that people are most familiar with. It's something that you've probably grown up throughout your academic career, taking tests or taking questions like this. So let's go into a little bit of the marking here. So the marking for this exam, all questions are weighted equally. Correct responses are worth 1 mark and incorrect answers are worth 0. 50% of the exam is going to be MSK. Now, here's the thing. This is definitely not proven to be the case. It's definitely showing that there is a lot more ethics questions. In fact, I would say ethics questions are absolutely taking over right now. And that's a big part about what you'll also find in our course, is that we have a very, very strong ethics, professional standards, and understanding how to work through these questions that are more along the what would you do type of questions, or how should you proceed. Okay. Now, this exam is a bell-curved exam, but it's probably not what you're thinking. You are not competing against your fellow peer. Okay. The passing score is set for the exams before the applicants take the exam. So assuming normal distribution, the expectation is that there are going to be some candidates who fail, and there are going to be a lot of candidates who pass, right? But you're not competing. So the score that you have, they're not going to kind of set a cutoff and be like, well, because we had this many people, then this many people are failing. Okay. So let's keep going on here. I really want to make sure that you understand what is going on as far as pass rate goes. Okay, so I really don't want you to stress too much about this. This is a very, very passable exam for Canadian grads. Okay. I'm going to say that again. It's a very, very passable exam for Canadian grads. Do you need to take a course? No, you really don't. You do not need to take a course, honestly. I think that this is an exam that the Canadian schools prep you very, very well for. I do think that it's something, as far as taking a course, that will help you just stay organized. If you are someone, and we'll talk about this kind of more towards the end, but if you're someone who just feels like you want a consolidated approach, you want to make sure you study everything the right way, and you also don't want to kind of put more time into this than is needed, then this is a really good option for you, is to take a course, but it is not needed. Okay, so we're looking at about 94% of Canadian educated test takers pass on their first attempt. So if we have 20 students and we're looking at a 94% pass rate, that means probably about 1 to 2 of those students are not being successful. So, I mean, the ratio is very, very high for passing. Okay. All right, so let's go over some study tips. So the first one is you absolutely have to start with anatomy, okay? Now the exam is not going to test you on basic anatomy, but you do need to know anatomy in order to build upon the other components here, okay? So this is a great area to use cue cards, to use charts. This picture right here is a picture of our anatomy workbook. It's a great resource because it has everything in one place and also has tons of quiz questions. Okay. So again, I'm going to reiterate, the exam is really not going to ask you like, what's the origin? What's the insertion? It is going to kind of layer on clinical scenarios that will require you to know anatomy. And I'm going to show you an example of this coming up. Okay. I do encourage you to start studying this now. I think it is something that, when I say now, I mean, who knows where you're at in this process when you're listening to me. But I do think that this is something that you want to be learning from the start of physio school. It is going to help you through every single course that you take. Honestly, I probably could debate this with anyone. I do feel strongly that anatomy is just going to help you really throughout this whole process. Okay. So get strong now, get good with it. Hopefully, you kind of came into physio school with a bit of an understanding, and this is more just of a review. Okay. Now, you do want to know small details. They say it's a basic exam, but some complex can be quite complex. I think the best way to show this to you is to quite literally show this to you. So I'm going to give you a Vignette style question on your screen here. I want you to take, normally I would say 1 minute and 10 seconds. I have a whole breakdown of how long you should take to do Vignette style questions in our classroom. But for now, I'm going to get you to take about 1 minute to read through this. Okay, let's dive into this question here. So I will give you the answer, I promise, but bear with me as I kind of take you through the process of learning anatomy that's going to help you for not just this question. That's a big thing. When you're prepping, we're not just prepping you for this exact question, because are you going to see this exact question? Probably not. But I'm going to prep you for the 100 different iterations that could come from this question. Okay, so let's go for it. How am I going to do that? I'm going to show you. We're going to be answering a question: what motor deficits would you expect to see with a laceration at each level? So we're going to go through each of these levels. The first level is going to be at the axilla, at the spiral groove, and then after the spiral groove. So in order to do this, you need to know the trajectory of the radial nerve. Now, the radial nerve, it starts, or it's a continuation, I should say, of the posterior cord of the brachial plexus, right? It therefore contains fibers from nerve roots C5 to T1. And this is going to be starting, or our picture where we're doing this is going to be starting at the axilla. Okay. It then winds around the back of the arm in the spiral groove. There's another name for spiral groove, and that is the radial groove. Now, it's always important, and just a little pause here, it's always important to know the difference. Terms, spiral versus radial. The exam tends to lean to the names that are less anatomically kind of giving it away. So if we call it a radial groove, you kind of know it's the radial. Spiral groove is a little bit easier. Even more so, they could say that you've had a laceration to the back of the humerus. Okay, so again, let's talk about the trajectory of that radial nerve. Starts at the axilla, continuation of the posterior cord, goes to the spiral groove along the back of the humerus between the heads of the triceps. And in the spiral groove, the nerve lies directly in contact with the shaft of the humerus. And this is why it's a very, very dangerous position here. So at that point of the spiral groove, only the lateral and long head of the triceps have been innervated. I'm going to say this again. At the level, or at the point of the spiral groove, only the lateral and long head of the triceps have been innervated. So what's left? Say it in the chat box for me. What's left? Yes, we still have our medial head of the triceps. So what does this mean? This means that we have, I mean, we do still have some elbow extension. Okay. So let's keep going with this. As it leaves the spiral groove, it supplies a branch to the medial head of the triceps. All right. So to enter into the forearm, the radial nerve travels anterior to the lateral epicondyle through the cubital fossa. And it's at that point that the nerve terminates by dividing into two branches. Okay. When muscles go into, when a nerve goes into a muscle and comes out two different nerves, these muscles are very important. So this muscle right here that I have on your screen, right here, this is one of those muscles where a nerve goes in and nerve comes out. It is a new person. What muscle is that? Yes, exactly. This is the supinator. There are several other muscles that do this in the body. I highly suggest you know it for your exam. Okay. So after it goes through that supinator, what happens is it branches off into our two branches. So we have our deep and our superficial. The deep nerve is also known as the posterior interosseous nerve. I would argue probably most people know it as that posterior interosseous nerve. The superficial branch is a purely sensory branch, and it's contributing to the cutaneous innervation of kind of the back of the hand and the lateral fingers. All right, but not as big a deal to know that. The big thing is we want you to know that after the spiral groove, what's happening is it supplies branches to that medial head of the triceps. It then goes into the forearm, splits into two, into our deep and into our superficial. Okay, I'm going to bring back the question. What motor deficits would you expect to see with a laceration? And let's talk about that. So we know our trajectory. Now let's talk about at the axilla. So at the axilla, if someone comes and snafu, if you could see me right now, I'm doing kung fu hands. Absolutely just knife chops that nerve right at the axilla. Well, it's kind of like you're cutting off a garden hose as it's just leaving the spout. It hasn't even got to the garden yet, right? Like it's just at your house. You've just plugged it in. Nothing in your garden is getting water if it is getting spliced so close to the source. So with this, we know that there's really nothing getting spared, right? We know everything in that arm is affected. We've got our triceps affected. We have all the posterior muscles of the arm, right? Okay. So in this situation, there is 3 points of lost extension. So we've lost the ability to extend our forearm, our elbow, our wrist, and our fingers. Okay. Now let's flop over to that spiral groove. So at the level of the spiral groove, this is really important. So before that spiral groove, the triceps are going to be, there's a laceration. The triceps may be weakened, but they're not paralyzed because the branches to the long and lateral head of the triceps are proximal to that radial groove, right? I'm using the terms radial and spiral interchangeably, but it is before that. So the big thing here is the muscles of the posterior forearm are affected. The patient is unable to extend at the wrist and fingers, but we do have spared long and lateral heads of the triceps, right? Because they are innervated before the level of the spiral groove, so they're still there, okay? So at the spiral groove, at the axilla, we've lost all 3 points of extension, forearm, finger, wrist, and fingers. And we look at the spiral groove, we have very much weakened elbow extension, and then we have no wrist flexion, extension, and finger extension. Now we're at that level after the spiral groove, and we're seeing that there are kind of two options here. So we have a laceration to the radial nerve superficial branch or the posterior interosseous nerve, also known as the deep branch. So what's going to be affected? So if the superficial branch is affected, there's no motor affected. It is a sensory branch. Okay. If the posterior interosseous nerve is affected, then we know that the muscles of the posterior forearm are going to be affected, except the extensor carpi radius longus and, of course, everything above it, right? If it's already gotten water before it's getting chopped, then it's getting water. So extensor carpi radius longus is innervated by the radial nerve, not actually by the posterior interosseous nerve. So it is already receiving water. Okay? Feeling okay with this? So Now, as a summary, we know where that radial nerve goes. We know what is going to be affected and spared in each of these situations. And now, wouldn't it be great if we thought about what is going to be in the vignette that's going to tell us that they could have an issue with the axilla, the spiral groove, or after? Because it's not often they're going to say at the level of the spiral groove, right? They're going to give a more clinical context. So here's how we're making anatomy all about clinical situations. So if we were to see something in a vignette that should make us clue in that someone has an issue that is going to affect the entire garden is not getting water, that's going to be something like a shoulder dislocation, a fracture to the proximal humerus, excessive pressure within the axilla. Physios love this, okay? Talking about excessive pressure in the axilla is just like, I don't know, maybe it makes us feel good and relevant and important that like we fit crutches, right? But ill-fitted crutches could very rarely, but a main possibility, cause some sort of kind of crutch palsy here, okay? Next, we're going to look at the spiral groove. And really the big thing that we want to clue into is saying a fracture of the humeral shaft. Anything of the humeral shaft, we're thinking we're dealing with things at the level of that spiral groove. Okay, as we go down to the forearm, if we're thinking that the superficial branch is going to be affected, we're thinking a stabbing or laceration to that forearm. And the deep branch of the radial nerve, we're thinking more a fracture of the radial head or a posterior dislocation of the radius. Okay. All righty. So let's go back to the question. We've prepared you for this question and arguably about 100 others. So we have our 38-year-old construction worker, lost my ability to speak, fell off a ladder, landed on a pile of broken glass. The impact of the fall caused a deep laceration at the humeral shaft. Okay, what does this tell us? At the humeral shaft. What does this mean to us? Well, we know at the humeral shaft, we are going to have, we look at our 3 points of extension, we know that they're going to have weakened elbow extension, right? So we can say this is wrong, lack of elbow extension. They're going to have some lack of, so A and D are done. Wrist drop is not wrong, but wrist drop and weakened elbow extension is going to be our best answer. Okay? Feel good? Great. Here is the answer just highlighted for you. Okay, stick with me. I promise we're going to get through the rest of this pretty fast. I should have you out of here in about 15, 20 minutes. Okay? So I want to go over some tips for studying for vignette style choice exams. I'm a big proponent of kind of touching something once and being done with it. And I'm going to show you how you are going to touch this strategy once and you're going to use it every single time you do any single vignette question. Okay. So what that's going to look like is we're going to work on timing. We're going to work on timing from the very next time you look at a question, whether it is a standalone question or a vignette style question. So as a reminder, vignette, we have our paragraph, then we have our follow-up questions, and then in our standalone, it's just one question, and then you answer it and you move on and it's a fully different question. So with this on the exam, 180 times 110 at 20 times 45, giving a rough review of about 15 minutes. That's going to bring you to about 4 hours, plus or minus about 5 minutes. So what you're going to do with every single question you do from this point forward, you are sticking to this formula, okay? If you go and take our 10 free questions that I'll link at the bottom of the video, you are going to take 1:10 times 10 seconds. Okay. If you are going to go and do some American questions, because American questions for the most part are all standalone, you're not going to take 4 hours to do a 200 question mock exam. You are going to do 45 seconds times 200 questions, which takes you to about 2.5 hours. Okay. You got to do the math. Now, if you're like me, you like some benchmarks. I'm a big believer in the kind of like midway point. That's really the timeline that I paid attention to when I did my exam. So at the midway point, at that 2-hour point, you're looking to be done about 104 questions. Okay. At the 3-hour mark, you're looking to be done about 156 questions. Alrighty. So here's what you are going to do. Your step one is you are going to read the question and then the vignette. Hear me when I say this. You are going to read the question and then the vignette. Do not do it the opposite. And the reason for this is that when you read the question, you are then going to have a more detailed, focused, I am not too sure what to call it. You're going to focus more on the vignette to pick out what you actually need to gain from that vignette. So we've read our question, which glide is most appropriate. We go to our vignette. We're seeing that this person had a dislocation at their PRUJ. They had significant reduction in their pronation and supination. The injury occurred 12 weeks ago. So just looking at this right now, we can say, okay, so the range of motion is 30 for pronation. For supination, it's 40 degrees. Alrighty. So after this was step 2, read the vignette. Our step 3 is going to be that we would answer the question. Okay. So what I want you to do with this is tell me what your answer is. That's it. All I want you to do is read the question, then the vignette. Pretty easy. Okay. I'm going to give you a hint. So in order to do this question, in order to remember 8 glides, 4 glides, 4 glides, 4 glides, in order to remember 4 glides, you are going to remember one rule, and that is PPP. Okay. All it means is when we're looking at our proximal joint and we want to do pronation, we are going to do a posterior glide. Okay, so this is important because if you remember this, you can work backwards. So if we wanted to be at the proximal joint again, however, we wanted to do supination, we would do the opposite. We would do an anterior. Same thing. If we go down to the distal joint and we want to do supination, we're going to do the opposite of what we did for supination at the proximal. So where we did for proximal, we did supination anterior. At the distal, we're going to do posterior. Okay, and then the last one we can figure out just by reasoning is at the distal joint, and we want to do pronation. We're going to do the opposite of what we did up here. So if we did posterior, we're just doing anterior. Now, this might take you got to pause, rewatch this, that kind of thing. It might take you a little bit, but I promise you, this is going to be a tool that you're going to use clinically for the rest of your life. I still use this. I kid you not. Okay, so let's look at this. They have significant reduction in their pronation. So the range is 30 and supination, the range is 40. So we know that the pronation is the most decreased, right? So if we're at the proximal joint and we want to increase pronation, what are we doing? Proximal joint, increase pronation, we're doing a posterior glide. Okay, hopefully that makes sense. The answer is B, posterior glide at the PRUJ. Make sense? Make sense? Let me delete these drawings. Okay, so let's keep going here. Let's talk a little bit about your study plan. So again, as a Canadian graduate, your study plan can be substantially less than an internationally trained physio. Okay, so if you're here, if you stuck into this and you are an internationally trained physio, disregard this portion. This is going to be for our Canadian grads. So for our Canadian grads, typically we're looking at about 7 to 8 weeks. I would say definitely people do study more or earlier than this. Most people who are gradding and writing this are either in school or on placement. So very, very common and a very doable combination to do those both. Okay. Plan for that last week to be spent purely practicing vignette style questions. In the Canadian course, you get over 900 questions. So you're going to get so many questions to practice. Make sure you're scheduling time for exercise, meal planning, social media breaks, whatever you need, whatever fills your cup. Make sure you are still trying to find a pocket. Now, here's the thing. This is not a time in your life for balance. It's not. There will be times in your life for balance, but this is not going to be one of them. Okay. So have a conversation with those closest to you. Maybe it's a friend, family, spouse, dog, whatever it is. Have an open conversation and say, okay, I'm going to be going through a very difficult 2, 3 months as I am on placement, as I'm finishing my research project, whatever that looks like for you. And I am going to need some help doing XYZ. For me, food is a big one. It's probably one of the first things I go that I just like default to like protein shakes and bars. But if someone brought me over like a wonderful veggie platter, I would eat it. I just don't have time. And those pockets where life gets crazy. So take some time now, if you're not in the thick of it, and just figure out what is needed to help you, because oftentimes people want to support, they just don't know what you want, right? So think about that, and please be selfish. This is the last time anyone is really going to feel bad for you as a little broke old student, right? You're going to finish this exam and you're going to be walking into a career where very, shortly you could be making over 100 grand. So there's a lot of sympathy that's going to come from someone who is making that. So I really do encourage you to milk it for all it's worth. Ask for all the help. This is the final push. Okay. Alrighty. So a few things, make finance style questions with each other if you want. You can switch them with a partner. Again, if you're in the course, you don't really need to worry about doing this. There are so many questions available for you, so you can just stick to those. You can have little 30-minute lightning round parties. This is something that we used to do in Friedman when I went to physio school. We would do these kind of quick fire questions, and it was lots of fun. Fun. If you could see me right now, I have like bunny ears around my words. Definitely make sure you're using our free resources. We usually have webinars about twice a month. I will send you the link in the webinar takeaway email. I'll also put the link below in the show notes. I will also encourage you to follow us on Instagram. We have lots of fun information on there. The CAPR used to release practice questions in a PDF format. We do have access to those too, so they're not on their website anymore, I don't think, but you can always email me. Our email is info@ptexamprep.ca. Okay, let's dive into the next fun part, and that is, what do we know about the OCE and how can you prep? The one thing I will say, actually, before we get too far into that, is just a little bit about the prep courses. In case you were here and you're not doing the Ontario Clinical Exam, the Canadian Student Written Course is $525. Now, it's actually not that much. It's a lot more, but we get funding. Every year we get an application that we put forth. We have to show our pass rates. We have to show our students' results. We have to show our materials. And it allows us to bring the cost down for these Canadian students. There's only two caveats, if you will, and you do have to show proof of it in order to get into this course. It is that you have to have graduated from a Canadian university in physiotherapy. And the other one is that you have to have graduated within the last 2 years. Okay. So if you go to register, you will see that we do require you to send in proof of enrollment. It doesn't have to be anything too formal. Sometimes people just send us in their student cards, their schedule. It does have to have your name on it. We really haven't had anything rejected as far as proof yet. So send what you have. And from there, everything is in the course. So you're going to have your entire course with all your videos. You are going to have your mock bundles. These mock bundles are amazing. They have so much feedback in them. You'll get your ethics masterclass. You're also going to get courses or mock exams within the course, quizzes. Seriously, it's a lot. It is great. I feel very confident that you do not need anything else than this prep course to pass your written. Okay. As a little incentive, if you are taking the Ontario Clinical Exam, we do give you $400 off if you've taken the written course with us, so it brings it down to $1,099. Now, regardless of where you're joining us from, the Ontario Clinical Exam is open to anyone. You can take it if you live in BC, you can take it if you live in Alberta, you can take it and never have stepped foot in Ontario, since it is a virtual exam. Pretty interesting, hey? And as a reminder, once you are licensed in any province, you can work anywhere in Canada. So if you take the BC exam and you're from Ontario, it doesn't matter. If you take Ontario and you're from BC, it doesn't matter. Once you get that slip that says, congratulations, you are a full physio, you're good to go. You're fine. You have, there's a Labor Mobility Act that allows you to work anywhere in Canada. So pass any clinical exam and you're on your way. Okie dokie, let's talk a little bit about this OCE course. So we know that it is a two-part exam. We know that part one is about cases and part two has 11 vignettes. Okay. Now to dive into part one a little bit more, these cases are going to be giving you different clinical situations. You'll need to analyze the scenario and respond. Each case is going to follow a template, and you will be guaranteed at least one of those cases to be MSK. Now, here are the main questions that they're going to ask you. Now, you can kind of pick up some themes. Case one is dealing with assessment. Case two is dealing with treatment. Okay. So lots of questions. You're going to be talking in this whole OCE for 3 hours. This is half the exam. So an hour and a half, you have two cases. So it's about 45 minutes of talking. So here is an example of a case from the Ontario College. I will stop talking in about 5 seconds here, but ultimately I just want you to take a look at kind of the top to about here. And then this below is just showing you some examples of questions that could be asked. Okay. So that's part one. And I will tell you, in our OCE classroom, we give you the detailed breakdown for the answer key for this. We have tons of cases in the OCE course for you to practice and go through. The Ontario College did not give an answer key to this, which is why we made our own up for you. Okay. In part two, you're going to be given a short 1 paragraph, and then you're going to have some situations that are kind of presented in that paragraph, and then you will have to answer questions. There's going to be 11 separate questions, and each of those 11 questions are going to give you a paragraph on each of these topics. Okay. Now, there is a very good example. I do like this example. I think this is a fair example. I think this is a question that anyone who is a physio should know what to do. So I'm going to put this on your screen. And again, remember, you would just be getting this top. These are the questions that your examiners would be asking you. Okay, so we've talked a little bit about part one. We've talked a bit about part two. In part one, you need to know content. It is worth it to ride the momentum of passing your written and fly right into the OCE, because you do have to keep a lot of that written information. This exam is more of an exam that is going to look at how, what would you do, not how are you doing it, right? We're not watching your hands. We're getting you to explain why you are doing things. Okay, so you really need to make sure you have a strong clinical reasoning for why you are doing things, not showing how you're going to do a joint move, right? Okay, part two is going to be a strong understanding of practice standards, how they apply to day-to-day life, very specific understanding of scenarios. This is more of a memorization part. Part two is definitely more memorization based. I think we have 170 practice questions just in part two alone. We want you to have seen as many cases as possible, because so much of part two is just going to be around, do you know it? And if you don't, it's going to be hard to make something up. Versus in part one, you can kind of finagle your way a little bit more based off of kind of clinical reasoning. Now, I appreciate if you're a new grad, you might not have a ton of clinical reason, which is why we have this course. But yeah, so part one, more about clinical reasoning. Part two is more about understanding these specific standards. All right. Within our course, we break everything up so that it's in very easy, learnable chunks. We create a comprehensive review for all the pathologies. You will get key information that could be presented in the case. I'm going to make this make sense. I promise. Stick with me. You'll get additional information. You'll get any information that could be gathered in the objective, approach to treatment, and safety considerations. Okay. So I'm going to show you an example here. Press play. So in this example here, you can see, so this is in the classroom, and now this is going to show you key information that's presented in the case. So this is how we explain the pathologies to you within the OCE classroom, okay? So you're going to get to learn about it. You would get to learn, everything that we think is specific to a severe traumatic brain injury. You're going to be going through, again, those key points, okay? Now, I'm going to scroll down just a little bit here. The next thing we're going to show you is additional information you may want to gather in a subjective assessment and objective assessment right at the bottom here. This may seem very like a lot of information if you haven't looked into what the OC exam is, but ultimately you have to perform a subjective and objective assessment in that case 1 of part 1. Okay. We have a subjective, excuse me, we have a subjective framework we want you to follow. That subjective framework is going to be applicable for literally any case. We've made it so it works regardless if it's a neuro case, a cardio case. However, every pathology might have like one thing you might need to add. And in this one, it's going to be, you're going to ask, do you have a history of seizures, including, if you did, what were your triggers for them? Okay. That's how you're going to show that extra level of clinical understanding of what's appropriate to ask in a subjective assessment. Same goes for the objective. We're going to show you for the objective different objective assessments based off of what the pathology is. So we have an MSK assessment for objective, a neuro, and a cardio rest. Okay. And again, within those, for your objective, we might ask you to add something very specific for the patient. But again, this is all very simple. It's all very well laid out for you. You then have your general approach to treatment, as well as all your safety considerations for the patient. Okay. Kind of take a look at that there. It's helpful. It really is. Okay, I think that's really what I wanted to show you there. The next thing I want to show you is in part it is still in part 1, and it's kind of all these strategies. So these strategies that you're going to get, you can see we're giving you all these different approaches. So we give you very, very specific things that you're going to do for developing problem lists, treatment plans. And I promise you, one of the things that we are really, really strong at is, again, touching it once and being done with it. You heard me say this at the start of the webinar. We're going to teach you the materials that way so that you can actually learn and understand it and make sure that you can explain why on an exam. And that's the way that you pass this exam. Okay, truly getting to that higher knowledge, higher level reasoning. Okay, so as part of the OC prep course, you are going to get your part 1 prep, your part 2 prep, and then you do get a live one-on-one 3-hour OCE. All right. So those are your options. If you are choosing to prep with us, you have the option of doing the Canadian student course for the written exam. It is a very specialized course. It's something that we get funding for, which is why the price is so low. And then you will get a discount to take the Ontario clinical course if you're looking for it. Okay. That is what I have for you here. Please feel free to send me any questions that you have. My email is info@ptexamprep.ca. I'm going to stick around and answer questions, as I said. If you do have them, feel free to send them to the group or privately. I feel like most people end up just sending it privately.